Thank you very much. Good evening, colleagues. Good evening to all the members of the media and compatriots. This evening, we want to thank you for joining us. We want to do a quick update as to where we are on the pandemic. We also would like to just give you a sense of areas which we are concerned with in the country. We also will be able to just give you a sense of what's happening globally and the areas which we are watching, because we tend to have the way the pandemic has behaved in the past. We received our first positive patient coming from some parts of the world, in particular in Europe. So we always keep an eye as to what's happening in the West because of our very close relationship. So we'll take you through in a form of a presentation, and I hope it's going to make sense. And as much as possible, we will then try and clarify a few things so that we can just move along together on this journey in South Africa. But at the same time, I just want to thank you, members of the media, for the reporting that you have been able to do over the past few months. It's really helped to keep the country, all South Africans, well informed. And so we will continue the conversation, as it were, at this point. So I'd like to start showing you a presentation, and then, of course, we'll open up for questions after that. Well, I'd like to take us through the latest of our figures. At this point, we have crossed the 750,000 mark in terms of total cumulative cases. I'd like us to focus on the slide as it's giving the latest as of today. The total cumulative cases stand at just over 750,000 positive cases in the country. We are reaching this point, of course, for the first time, but I think it's important to indicate that our numbers continue to grow. If you do look at the distribution of where the highest numbers of positive cases are, about 31%.
Sorry.
31% are in Gauteng, and about 17% in KwaZulu-Natal, about 16% in Western Cape, 14% in the Eastern Cape, and the rest are below 10%, with the Free State at about 8%. It's important to just look at those figures because I think we entered the wave with different numbers as well as at different times as different provinces. At this point, our total deaths have exceeded 20,000, which is 20,241. And then the case fatality rate stands at 2.7%, which is relatively comparable to what is happening in the whole world. The total recoveries are at 693,467. That's equal to just about 92.3 or 0.4%, which is a very good recovery rate. And as we see, the active cases are 37,000. Now, this for us is the latest in terms of this situation in the country. I think it's also important to have a look at the journey that we have traveled. We started around the 5th of March with our first patient. Was positive. We've actually moved on now for 45 weeks. We're on week 45, and in the process, we've gone through all the stages, and at this point, we are at what we call level 1, with a lot of restrictions having been eased and an effort to try and get to the normal as possible of our daily lives and economic activities. That's the journey that South Africa has had. You'll also note that the numbers started rising when we were at what was level 4. They went up, but even more when we went to level 3. That's when we experienced the surge from June to July. And therefore, at that point, we started seeing as the numbers also were declining. We did indicate over that period that our predictions were that we were going to have this surge with lower numbers, which was very helpful for us to be able to prepare our health services to be able to contain as many of the patients as possible. As it happened, we never ran out of beds, we never ran out of oxygen, we never ran out of ICU beds or ventilators. In fact, most of the equipment, the ventilators, were not actually used there. So we made provision which was adequate to cover the situation in which we were. This graph, we might recall, is an indication of where we started, and then all the surge is showing, the different colors are showing us different provinces, with the highest surge being with Gauteng, and of course followed by KwaZulu-Natal, and then Eastern Cape and Western Cape. This pattern, as you realize, started early in June. In fact, in the Western Cape started in May. But over that period, the peak were at giving us up to about 13,000 positive tests in a 24-hour period. And at that time, we were able to do close to 46,000 tests. And so this is an indication that we were able to cope with both the tests as well as we were able to also track for each and every province to be able to see what pattern was going on. Everything then went down until around the 30th of August. We will see that after that, everything went on to a plateau. That plateau has gone on up until the past 2 weeks. Now, it's important to say that that plateau didn't give us 0 patients. That plateau gave us, we dropped from about 2,000 positive cases per day, went down to close to 1,000 per day, but we started moving back to 2,000 positive cases per day. What you will notice also, if you look at that very busy slide, is that there are provinces which lag behind in their peak, such as the Free State and the Northern Cape, and probably and also Limpopo and Mpumalanga, but particularly Northern Cape and Free State started showing higher numbers, which are part of the same surge, but happening a bit later. And so that pattern is important to note as we move on. But if you look again now on the 25th of October, all the lines were equal, lying flats, but then you start seeing 2 lines that are beginning to jut up. Those are the areas of our concern. And the one gray line that's going up is the indication of the numbers that have started increasing in the Eastern Cape. And then the one which is an orange line, slightly moving up as well, is the numbers that are already showing some activity in the Western Cape. Now, these areas are areas which we are now watching as indicating increased activities. Whereas when we look at this is a new phenomenon. It's not the same as what we are seeing in the Free State and Northern Cape, because there they got onto the same first wave late. But these two got into the first wave, went to a plateau, and they were stable, and then they're already now showing new activities. Those are the areas that I just want to, to talk about as we move on. But this is to indicate now that we have started seeing a little bit of increasing activities in the Eastern Cape and a little bit in the Western Cape. We can't yet say this is a new surge. We're basically saying we're now observing these areas, and it's important for us to share with fellow South Africans that this is what we're now seeing. Now, another area which I think should be interesting to all of us, you may recall that way back in July, as we're moving on to the peak, South Africa was recorded as number 5 in the world in terms of the highest number of positive cases found. We had moved quickly up. The rest of the world seemed to have been coming down, and so South Africa moved up. Then you will see that US with 11 million, India now at almost 9 million, Brazil at 5.8, and France at 1.9, and Russia at 1.9. But South Africa has been pushed down. 3 weeks ago, South Africa was around number 10, and then of course you see that it has now been overtaken by Spain, UK, Argentina, Colombia, Italy, etc. And now we're at number 15. And if you looked at Poland at number 16, with the numbers that they were showing of new cases in 24 hours, within a few days, we might end up being number 16. If you look at the other countries below, if they keep those numbers, it's likely that South Africa might also be pushed further down to number 18, 17, or 18, depending on what's happening. But that actually is the point which I think is important for us to note. We were once much higher, and the reason why we went down, we went up, is because we increased our own positive cases more rapidly than any other part of the world until number 5. Now, this time it means the other countries are also increasing their positive cases faster than South Africa, which means what happened to us before, where we started rising fast, can still happen to South Africa again. And that's why we think it's important to share this kind of information, that the other countries are already experiencing a second wave, and that wave is pushing a lot of them up in terms of positive cases. We never got to a zero number, and in fact, some of the countries were even better off than South Africa. So it's important for us to keep a note of the fact that this pandemic is a very dynamic situation that keeps changing in different countries. The second point I think we need to note is that when we went on to the lockdown and we stopped international travel, we had actually had a number of people that come from a lot of these countries. So in other words, we do have a relationship with a number of the countries that are already showing an increase at this point. Now, if we can just move on. Now, I'd like us to pay particular attention to a number of countries. We will try and see if we can move slowly so that we can be together. The first graph on the top left says Peru. So if we follow what happened in Peru, the graph shows that they had an infection, then the pandemic went up and it peaked, and then it started a plateau. Then somewhere along the line, before it came below, it came to about 3,000 cases, it started rising again. You'll notice again that the second wave was higher than the first wave. And that's where they are right now. That's why they are higher than South Africa. We pick up the second one at the bottom. Bottom left is France. France had a wave, and then at that time it had lots of challenges, but then it came down to a plateau and everything seemed to be fine. And then in the past few weeks, France has started showing an increased number. At this point, their numbers are still increasing much higher than they were in the first wave. You go to the next countries, there is Spain at the center. Again, Spain had a huge wave, and then it came down. It came down to a much lower level, which gave an impression that they'd completely contained it. But then there's a surge. The surge is still rising right now, the second wave, and as it goes up, it's indicating that it's higher than the other country, the previous wave. And then USA is a similar pattern, first wave and then plateau, and then went up on the second wave. It's on its way down. Italy, the same way, it's now rising again, in Italy. And then, of course, the UK is the same thing. I think the moral of the story here is that the countries that had infection, the pandemic started earlier than South Africa, have now gone into the second wave. And in general terms, the second wave seems to be higher than the first wave. And so it's something that we need to note, because we only got infection much later than these countries. Of course, there may be a lot of different conditions that we have. Now, if we do an analysis on the week that ended just the last week, around the 7th of October, we were at about 737,000 of confirmed cases. If you compared with the previous week, you notice now that there was a slight decrease of about 18%. So we compare everything. We compare day to day. We compare week by week. We compare every fortnight and see what trends we're having. So there was a decrease of about 8% at that point, and compared to the number of new cases which were seen on the week 44. Then the fatality rate I've indicated is 2.7%. What I think is important to note is that we are doing a number of quite a high testing rate. Those 4 provinces are provinces where we're doing high testing, around 200, over 200 per 100,000. And the reason why I'm indicating that is because the Eastern Cape is showing numbers going up now. So we are saying that we're still going to increase testing, but it does indicate that we're still testing pretty high together with the Free State. Free State is still in the first wave, and therefore they're on their way down, but we're still testing very high, including Northern Cape and the Western Cape. So it's important to increase the testing when we, particularly as we begin to see the numbers increasing. Of our healthcare workers, we do want to indicate that at this point, 35,490 have actually been identified as positive, having been infected. And then the others who were admitted were 4,368. We unfortunately lost 338 of those health workers, and may their souls rest in peace. Then the others are discharged and transferred. So effectively, we just wanted to give an update, because we've had a lot of debate and lots of work done to try and make sure that our health workers are kept protected. And I think all of us recall as well that the president has actually said across the country, we're going to have to go onto a day of mourning to commemorate those lost lives. This is indicating that whilst we talk about Eastern Cape, actually the COVID activities is found in a number of different parts of the country. If you look at everything that looks dark red, you will notice that it's found in the Eastern Cape, but also some in the Free State and some in Limpopo, Northwest, and so on. So the whole country, we're doing a monitoring to see where activities are. And therefore, we will notice, we'll also indicate to you that it migrates, depending on how it's managed, you move from one sub-district to another sub-district. But in this case, this is what we've got throughout the country. And so it's spread right across, so Pito, Western Cape, Ndlambe, Eastern Cape, and a number of them are in the Eastern Cape, of course, Limpopo. This is just to indicate that the distribution is quite wide, but there is quite a focus on the Western Cape. So when we talk about resurgence, we're looking at 20% of the increase in the average incidence of COVID cases. So we look at 7 days, and if we see a 20% increase, then we start thinking that, look, this is now a resurgence. And so we would like to also try and define it as close as possible to a geographic location, whether it's a ward or district or province. Now, we look at various indicators, testing rates, how many, what's the testing rate. We had come from about 27% of positive testing rate, went down to about 10. And so if you look at different provinces, it keeps rising depending on how many. That means testing rate means in every 100, how many are positive cases there. So we look at that, look at new cases per day, look at positivity. Testing rate is more about how many patients do we, how many tests do we do and positive rate is how many people of the test that are positive, how many are actually positive. And then we look at active cases who have reported about hospitalization and mortality. So those are the things that we're actually looking at as well now, looking at resurgence. So if it's less than 10% increase or decrease, it means it's under control. If it's between 10 and 20, it means we must go on an alert. If it's more than 20, that means we might be dealing with a resurgence and therefore must start acting. So the plan on resurgence has been worked together with WHO. So it involves improving heightened surveillance, and then of course we have to deal with different districts and sub-districts in a differentiated approach. Where there are problems, we must intensify resources, and then scale up and testing and contact tracing. That's still standard for us. Then, of course, case management, availability of beds, oxygen, and so on. This has been under pressure now in the Eastern Cape. Then we have to enable quarantine and isolation, strengthening those issues and mechanisms to manage hotspots, and look at intensifying education on adherence to non-pharmaceutical interventions. Those are the standard toolkits that we have spoken about in the past. Just indicates that we're back to that issue now, where all the standard interventions must now be looked at. So if you look at the Eastern Cape, these are 2 weeks, these are 1 week apart. One on the one side, on the left, you will see the more darker red are indicating that there's more intense activity there. So you will see that if you looked onto the right, some of the districts that were already were very positive and left are no longer so on the right, but some that were not so on the left are now so, for example, in the Nelson Mandela area. So the country needs to be blue, green, and yellow. Once it gets red, we're getting concerned. So if you compare the two, this is just shift from 1 week to the other. So when we start looking at the whole country in the next few weeks or months, you will see that this picture might have changed. If we had contained it, it will be much lighter. If we hadn't contained it, it will actually be much more intense. So we will be going to the Eastern Cape, and then we'll announce our interventions when we get there. This other point is just a point which we just want to make, because we want to always track everything and make sure that there's no question about undercounting the numbers of people who could have passed away at that point. Now, there is a concept of excess deaths, which we normally use to check how many people died last year or 2 years ago in a particular month. And then once we look at those numbers, we then try and plot how many new additional deaths which might be related to the fact that COVID might be having an impact at that kind of level. So at the moment, for example, just to get a sense, from January to October, there have been about almost 450,000 deaths. That is ordinarily. Then when we see a variation that's showing a slight increase, like in this case, over the same COVID period, we've seen a variation of about 48,545 deaths. We classify that as excess deaths because they could well be COVID, but mostly not COVID, but the environment around which all of the COVID activities are taking place could be having an impact on others to die off their pre-existing conditions anyway. So that's an issue that we believe it's important just to share. Then the message out of all of this is that it's important to adhere to adhere to non-pharmaceutical intervention. We need to send the message very strongly of washing hands, sanitizing, social distance, wearing masks. It is more important now than before. We need sustained behavioral change because it needs to be mediated by communities. We're now seeing some people are showing fatigue and so on, and it's difficult to have an enforcement of masks unless it's a social mobilization that we're doing. Of course, preventative care remains very, very important. And therefore, we are working now on social behavioral campaigns to try and encourage people to focus on what will keep us safe during the festive season. So the day-to-day festivities have to be done differently, and that is important for us to start gearing ourselves for a slightly different Christmas. I'm not talking about lockdown. I'm talking about just changing the way we do it so that we don't go and enjoy and then end up with an infection. Seeing that, we are seeing that there are breakups in a number of areas that are showing an increase. In these areas where we're seeing increases is cluster outbreaks. For example, in the Eastern Cape, there were instances where with students' parties that we believe had a huge impact. If you look at the boundary between the Eastern Cape and the Western Cape, we think it's related to the seasonal workers that go through those particular areas. So all in all, as we are dealing with this issue, we are identifying cluster activities, cluster outbreaks. Those cluster outbreaks don't necessarily mean that the whole country is going to go into a huge resurgence immediately. It means if we manage it well, we've seen, for example, in the Western Cape, a few weeks ago, I was very concerned, and there were cluster outbreaks in some of the areas. They have been extinguished, and there have been a few areas in the Eastern Cape where we've seen that they've also managed to put them under control. But the Nelson Mandela area is one that is causing a lot of challenges. And because of that, we have to now deal with it and try and see whether those numbers can be contained. Otherwise, of course, you know that it can start flaring up to different parts of the country. Without, therefore, that we must come and share this as just an update so that we can then talk about it. COVID-19 is still very much with us, and other than our non-pharmaceutical interventions, wearing of masks has to continue. We need to encourage more and more people to wear the mask, wash hands and sanitizers, and also avoid what we call super spread activities, where people cluster together without any precautions, and then they end up with more people getting infected of the COVID-19. That is where we are at this point. So thank you very much, compatriots. Let's request if you'd like to clarify any issues, let us do so. But this was just to make sure that we all up to date as to where we are. Thank you very much.
Thank you very much, Minister. I am getting questions coming through. Minister, I'm sourcing questions from both my WhatsApp group as well as from the Zoom group chat. And so some questions you may be able to follow on the Zoom group chat, but I will also read some questions, Minister, from the ones that are coming through on my group. I'll begin with the questions that are on my group, Minister. I have a question from Mariam Issa from FinWeek. The first question is, with the USA, Europe, and the UK hard hit by second waves at present, is it not risky to open our international borders to travel at this time? And I have a question from Krista Beer from Harry Gwala FM. Is the second wave already arrived in South Africa, and can people use umhlonyane? And that's from Krista Beer. I have a question from Kyle Cohen from News 24. Minister Mkhize mentioned hospitals in the Eastern Cape are under pressure. Can the minister please clarify and give us an idea how bad the pressure is? I then also have a question from, this will be the last, give Minister an opportunity. I have the last question in this batch from Estelle Harris, The Herald. The Eastern Cape Department of Health's epidemiological reports are showing that testing has been slowing down in the past few weeks. Will this be addressed by the intervention plan? Secondly, for months before last week, the reporting on deaths and the number of cases in the Eastern Cape was sporadic and often wrong. In one instance, the number of recoveries reported as higher than the number of cases. Will this be addressed? The third question from the same, from also Ms. Ellis. The problem of staff shortages in Nelson Mandela Bay were first raised in March. Burden on the staff working on, or is the burden on the staff working in the public sector is now very heavy. Any plans to address this?
Sorry, Lozi, you did disappear for a while. Just repeat that last question.
Yes, Minister. The third question from Estelle Harris at the Herald is, the problem of staff shortages in Nelson Mandela Bay were first raised in March. With the cumulative impact of the increased number of cases, fatigue, and the non-replacement of staff who died, is the burden on the staff working the public sector is now very heavy. Any plans to address this? Thanks, Minister. I'll stop there for now.
Thank you very much. The first question, USA, UK, different parts of Europe are showing increased numbers. Is it not so much of a risk to open our borders? There's always going to be a risk if we open the borders. The real question for us has been, how do we begin to go back to normality as a country? And therefore, you would notice that what has happened over the past few months, we've been trying to do what the president called a risk-adjusted, release of restrictions. So we don't have to, insist on restrictions unless we think that they are practically going to make an impact in South Africa. So up until we got to level 1, everything was fine with us. We didn't have a problem, but we still noticed that there were challenges in the various countries. So our first step in dealing with this was that we should be able to open up to most of the African region so that the movement within us can be monitored, but the risk is much, much lower for any part of the continent if you compare with the rest of the other world, particularly the West. So from that point of view, we felt it was important to open that. Then we went through looking at a number of countries where we thought that their numbers were pretty high, so we needed to exercise caution on some of the countries which were showing much a higher positivity rate. So we will continue to be very cautious at that level. But what we think is important is also to look at how, as people come in, we reduce the risk, because the risk will remain high irrespective. What we need to try and do is to be able to detect when somebody gets into the airport, whether we can actually have evidence that they did have infection, they didn't have infection in the past 3 days, or as we're going to be introducing the antigen test, we're going to be testing to see whether there's any evidence of an active viral infection with them. Now, those are likely to help us, even in countries where we might have thought that the countries were low risk. So we're going to have to work on it on the basis of, what's the best way of reducing, the entrance of someone who could subsequently spread infection in the country. Some of the people who come from these countries will come into South Africa and spend several weeks, maybe a month or more than a month and so on. So if you have anyone who comes from that area and you actually restrict them to a quarantine for 10 days and they were negative when they came in and they went on to a quarantine after that, and we insist on the IT that must indicate whether they've been in contact with someone who's positive or not. After about 10 days, when there's been no symptoms, that person is just in the same position as South Africans, and therefore, those can be managed. So it's a matter really of managing the situation as we walk along. Then the second question was, are we on the second wave? The second wave arrived. Actually, we can't say the second wave has arrived. We just see in cluster activities increased positive numbers in the Eastern Cape. Now that it depends on how we manage the situation in the Eastern Cape and some of the areas where we're seeing the outbreak. It can still be contained, and if it is contained, it might actually peter out and not show us, a flare-up that goes into more different parts of the country. But if we don't manage it properly, and maybe we are not able to get it contained, then of course it might start spreading. Because what you're seeing is that the activities are still quiet in a number of areas. But just remember as well that in the previous surge, not all provinces went out into a surge at the same time. Western Cape got out of the way and then continued with the numbers. Now, Eastern Cape is almost more or less starting that kind of pattern. But because of our experience, we have to try and see if we can actually contain it and therefore manage it from there. What is important is the overall behavior of South Africans, because if we all continue with use of masks, distancing, sanitizers, and hand washing, and limit our numbers and activities, and so on, where we reduce the chances of the spread of the infection, we can contain this and delay it much further without much more restrictions than already existing containment measures. So that's the message which we want to send, that the containment measures helped us to be where we are. They can still help us to delay it further. We cannot give you an exact reason why there would be now a surge. Our current focus are not showing us that there's going to be a huge upsurge at this point. But obviously, those focus will be guided by numbers, real data. So that's the situation that we're looking at. Use of Umhlonyana. Umhlonyana has been used for generations. You know, I always recall that when we were young, we never used any of the medication that's used for flu. That's the stuff that we used to use. So anyone who wants to use Umhlonyana and they know how to use it, then of course it's up to them to use it. There's no issue about it. But the main point which we're dealing with here was that these are natural products which people use and they don't need anybody's permission or recommendation. But all we can say is that please use it. If you use those natural products, just make sure you get someone who knows how they are used. That's all I can say. But on the other hand, it doesn't mean that we have evidence that the Umhlonyana actually has got a particular action on the virus, on the COVID-19 virus. So that is research work that still has to go on. That's the situation. Then we have on this call, on this brief, Dr. Zungu, who is the acting head of department in the Eastern Cape. I'd like her to look at some of the questions that have been raised. You know, Eastern Cape hospitals that are going through challenges. Let's look at that. All I can say is that our testing, our issues of staff shortages and all of that, we're going to look into those issues more intensely when we get onto the Eastern Cape on Tuesday. But also that throughout the whole country, we're aware that there's been a lot of pressure on health workers, and we really thank them for their dedicated service. We understand that there will be areas where people will be having fatigue, will have challenges where there are still shortages of staff. But we did try during the COVID months to actually increase the numbers of staff. We employed additional nurses and doctors and so on into these particular hospitals. So we were able to relieve the pressure at that time. Obviously, we now need to make sure that our staffing levels are sustainable. We've just adopted a human resource development strategy, which is able to guide every province to say which way should we be going in terms of our balancing our human resources. So that area is the area which we believe is important to keep an eye on. So that would be our focus on that. The numbers that sometimes we find miscalculation, every now and again that problem will arise. I've seen it in some of the countries as well, where there's a debate about numbers. The key in this is that we need to insist on a known methodology of how we do the reporting, and we must therefore do our double checking. How do we audit those numbers and counter-check with the different agencies of government? And at the end of the day, if you find something has been wrongly reported, we must own up and then correct that immediately and go back to the numbers. Because of the fact that on the one side, you've got the department that's got to report, and on the other side, we've also got laboratories that are reporting NICD that's looking at issues, MRC. So some of the errors we can spot and then bring them back to normality. I think it's something that is correctable, even if wherever we find it. We have, for example, been discussing in the Eastern Cape where there were challenges. We go there and try and see what went wrong. We were discussing with the Western Cape how they are managing the figures, and sometimes we find that we need to align two arms of the department so that they can correct that. The Free State were exactly the same thing, that to give us a whole report about how the numbers have actually been managed over the period. So it will arise every now and again. All I can assure you is that if we pick it up, I will report it and correct it. Could I ask if Dr. Zungu and maybe Dr. Buthelezi might want to respond to any of the issues? If not, we can continue. We'll try and find them on the next round of questions. Thanks, Lwazi. If Dr. Zungu is available, we could ask her to respond.
Thank you, Minister. The issue of the hospitals in the Eastern Cape, the hospitals that are under pressure are mostly in the Nelson Mandela Bay Metro. And for those hospitals, fortunately, the Eastern Cape invested in infrastructure projects, and one of the hospitals had wards renovated, and there are 100 beds available at Doranginza Hospital, and they are going to be operationalized tomorrow to ensure that we cope with the second increase in the number of cases. At Livingston Hospital, there are 72 beds that have been made available from the basement that was prepared for the 2010 disaster management, and those have been made ready. And there has been a drive to recruit doctors, and also the doctors that come from Doctors Without Borders will support. At the same time, there are doctors that are going to be moving from quieter districts like Alfred Nzo and OR Tambo district that are going to be moved to Nelson Mandela Bay Metro. Those are the part of the Cuban brigade that came earlier in the earlier part of COVID-19. Thank you, Minister.
We can take the next batch of questions. Thanks, Lwazi.
Thank you, Minister. I have just one question from my group, and then we will move on to the questions that are on the chat group. From Claudia Malovich in Business Day, can we please get an update on vaccine access? And her second question is, are you considering placing restrictions on mass events such as the Plate Rage over the festive season in light of the possibility of these events becoming super spreader events? Now, Minister, I'm moving on to the chat group. I will read a further 4 questions from there, and then we'll hold it at those 5 before we go to the next batch. Evening, Minister, from Jane Simmons. How do you see the role of health promotion in managing COVID-19 going forward? The next question is from Maurice Smithers from SAAPA SA. We are particularly interested in knowing what specific steps will be taken under the state of disaster to minimize the alcohol-related harm that is likely to take place this festive season. There will be increased consumption over this period, as well as large gatherings. Excessive alcohol consumption will lead to non-compliance with protocols and other infringements which could contribute to the spread of the virus. It would also result in alcohol-related harms, different kinds of violence, road crashes, all of which will put pressure on hospitals. And alcohol-related road crashes are higher risk this year than usual, because more people will be on the road this festive because no one could go home on holiday during the Easter and July holidays. We believe extraordinary steps should be taken to minimize the harm that alcohol can cause over this period. And they've also said that they have some specific proposals in this regard. The next question, Minister, from Nkasa. Minister, most of the people who are positive before this COVID-19 wave are still feeling chest pains, throat pains, and joint pains. What can be done, or what is the plan for this aftermath? So I think here, Minister, they're referring to the long COVID syndrome. From Peter van Husten, he has two questions, and I'll hold it at there for now, Minister. More testing is still happening in private than public sector, and more people are hospitalized in private sector than public sector. When only 15% of people in SA have access to private healthcare, how can this be explained? And his second question is, what data is available on contact tracing, and what percentage of contacts have been traced? As this info is really hard to access. Thanks, Minister. I'll hold it there for now.
Well, thank you very much. We may not be able to answer to all the questions, but let me just attempt on a few, which I think are important. Some of the points that are being raised are points of advice which we acknowledge, and so thank you for that. The first issue relates to alcohol. There's no doubt that alcohol has a negative contribution to a number of aspects of our lives, and therefore in the health of the population, there's quite a lot that you can actually identify that may be an adverse impact of alcohol. During the COVID situation, we came to a number of instances where we were to analyze the impact of alcohol and take steps on that. During the surge, we had to actually close down alcohol sales throughout the country because it did contribute towards filling the hospitals, and therefore in the process of overcrowding, not only was it spreading the infection, but it was making it difficult for health workers to be able to attend to those who are sick, and makes it very difficult to manage COVID precautions when people are bleeding and rowdy and unmanageable and rude and ill-disciplined and all of that. So you get all of those kinds of problems, and health workers really did feel the strain at that level. However, the question is, are we then looking at putting up new restrictions? Well, we have to try and balance a situation of should government be sitting there and determining when people can drink, when they shouldn't drink, and so on. It's actually, in a democracy, very difficult to do that. Maybe even as we had to take the precautions, we had to go to court to prove that there was actually scientific basis for restricting alcohol. There were lots of applications to court to deal with that. So, but our approach would be, we don't have yet the basis on which to do the same restrictions that were done before. And therefore, we play it by ear. Whenever the situation might arise, it will require certain restrictions, government will not hesitate to bring those. We're not at that level, and we hope that the way we behave might keep the resurgence so far that we don't need government to be putting up additional restrictions. Certainly not on the issues of alcohol. But we do need a conversation as South Africans on what can we do to reduce the excessive consumption of alcohol and all the negative outcomes of imbibition of alcohol. So all of that are fair questions, but they actually are societal discussions. Because when government takes a decision, government has to prove that there was scientific basis and direct impact on the issue that we're managing. We will have no problem proving that when we take such a decision. It's just that it's not something that we will do simply to just restrict people, but we will do it only if we are able to prove that immediately we do those restrictions. It's going to have a positive impact on the way we're managing. So it's one of the issues that we will keep in mind. Major events, we will be working together with various levels of government, particularly district and local, to be able to look at how those events are managed. At the moment, no decision has been taken to ban any particular events. We go by the regulations that have just been issued now, and so everything that fits within those regulations should be able to be undertaken. Anything that doesn't fit, obviously, may not be undertaken. So that would be the issue. The point about health promotion is fundamental, for a healthy lifestyle that we embark on, a health promotion for people to understand what they need to do. It starts with the way you look after yourselves, the simple issues of cleanliness, hygiene, the simple issues of normal diet and peaceful environment in which you work, and all of that. And then what kind of dietary restrictions are important, physical exercises, and all of that. All of these issues are actually part of the health promotion, which when you deal with the situation of COVID, you deal with it on that understanding that information is what will help people to understand the best behavior so that they can reduce the impact of the spread of the infection, the numbers of people who get infected, numbers of people who get to be severely affected and therefore admitted into hospital is all linked at that level. Then the question around vaccines. Well, there are trials that are going on at the moment. We would obviously have heard that whilst those trials are going on, they are linked to some other initiatives to further develop the vaccine and manufacture them. And in this case, in South Africa, we have one initiative that involves Pfizer and which has come into the country and has been in touch with BioVac in South Africa to look at whether there can be technology transfer at that level. None has been registered yet, and some it's believed that might be ready for registration in the US around December. And so we will also obviously follow after that based on the success of our own trials, as well as the situation that we are, the development in the rest of the world. The other one was a Johnson & Johnson one, which was announced as well by President, where a partnership with Aspen has been also agreed upon, and they are looking at a conclusion of the trials early in next year, and some time during around May. There could well be, by that time, if things go that by then there could well be a registered vaccine, and therefore they'll start producing these vaccines. We are also discussing on the platform which is called the COVAX facility. Here they've recruited 9 of these vaccines so that different countries have to put in money and try and support the successful vaccine bid so that it can be made available to more countries and not just be restricted to the rich countries who can hoard all these resources. We have actually taken a very strong stand on equity in the distribution of vaccine, and also ensuring that there's no resource nationalism that begins to exclude poorer regions, low-income countries, and so on. We are also part of what President is co-chairing, what is called ACT Accelerator. And again, here it's looking at diagnostics, therapeutics, and vaccines, and looking at all of these things working together. And the slogan there is, no one is safe until all of us are safe. And the approach is that we need to make sure that whoever gets a successful vaccine, that process must be open to as many people in the global community so that there is no one who gets left behind. The question of testing, we have still more patients, more positive tests that are still being done in the private sector. What we don't do in the government, in the public sector, is anyone who would just walk in and say, oh, I'd like to have a test. Are you sick? No. Have you been in contact with anybody? No. I just want to know. So because of that kind of divergence, you might find that there might be increased numbers in the private sector. We call it worried well, which means they may not be having all the strict criteria for which they should have qualified for testing, but they were able to afford it, and so that's what might happen. In the process as well, we also are looking at, we have opened up the criteria in the government services and in the public sector, and we've said that they must admit, everyone who goes for theatre must be tested, and those who get admitted into hospitals must be tested, and so on. We're now pushing that message so that we can match up the numbers in the different parts of the country, so that we can match the numbers to be able to give us, a high response, a high yield that will give us a better surveillance. We'll keep at that level. The admissions, I wouldn't be able to comment on that at this point. It's something that I might want to just throw back to say our team could explain what was the reason, what was happening, so that I've got a better understanding as to why there are more increased admissions in the private sector. Obviously, there is always a balance between what the affordability and whether, in fact, there is any pressure on the individuals who might wish they need to be admitted. In the public sector, we have very strict criteria. All I'm comfortable with is the fact that in the public sector, there will be no one who deserves admission who will not be admitted. And we never run short of beds, we never run short of oxygen, we never run short of ICU. And therefore, there is no discrepancy in terms of those who should have been admitted that is not being taken care of. The contact tracing, I don't have the numbers here. Maybe you can just have a direct discussion with Lwazi so that we can send you the numbers so you have a sense of those numbers, not only just contact tracing, but also the use of IT and so on. We don't have the numbers immediately. All I can say is that we have to emphasize on this. And this is, again, where we're going to need the support of the public media as well, because there were instances where people were not wanting to divulge information, and in some instances don't even want to take up isolation or quarantine for whatever reason. So that's the work that we have to deal with, because it's going to be important to break the cycle of infection. Thank you very much. I don't know if you still got any other questions.
Thank you, Minister. Minister, I will ask one more question, which has been asked by several journalists and people commenting on the group, and that is if Minister could address the issue of antigen testing. Firstly, its utility and testing campaign in terms of our seroprevalence studies, where we're at this moment in time, and how we will be moving forward with assessing the national seroprevalence. Minister, thank you very much. We will close it after this question.
All right, let's pen the issue around antigen testing. So we'll talk a little bit more about that when we get to the Eastern Cape. But this one on seroprevalence, we've done two surveys. The one survey was done in the Western Cape. In the Western Cape, basically what was done is to take people who had come to, were taken tests for something else. Then they wanted to check amongst those how many could be showing antibodies for COVID-19. They found something very interesting, that in the Western Cape, well, let me say in Gauteng, they were able to see that about 22% of children under 10 and between 10 and 19 were actually showing antibodies at that level in that cohort. And then there was another batch of those who are older than 20, where they found between 27 and 30% who were also showing positive antibodies. But that situation was a situation where we were quite clear that the numbers that were showing of antibodies was higher than the people who were tested positive before. In other words, it was suggesting that there are more people who have been exposed to the infection and developed antibodies than there had been reports of those who were tested. In other words, the numbers of people who are testing are less than the numbers who have already been exposed to the virus. I think we have been saying this for a long time, because a lot of them would have no symptoms or very mild symptoms which they can ignore, and then they go on without testing. In the Western Cape, the figures went as far as some of them were women who had come for antenatal care. The figures were as high as 37% up to 42%. So those numbers showed us that there was a lot more infection than there had been numbers of people who are positive. But you see, we must always remember that unless we do a study which we are working on, which will give us a proper sense of prevalence of antibodies on people in the whole country, we would not know for a fact, because that batch of people are not necessarily representative of the whole population. So we need to put a caution there. The second caution which we need to put up is that as much as there would have been people who were positive, who have got antibodies and probably protected from the infection, we can never know how many, and therefore we still have to take precautions and not create an impression that, oh, maybe I'm amongst those who have got antibodies, so I may be safe, particularly the youth, that we must not take such a reckless stand. The third one is that even if we had 27-30% of the people showing antibodies, or even the case of Western Cape, 37 to 42%, even if that was the number that we had in the Western Cape or in Gauteng, but you still got another 60% who can be infected and with devastating impact. So we don't need to be complacent. We need to know, even if we answer these questions, we must not rush to a point of where we do nothing. We must keep to the precautions, the use of masks, sanitizers, the use of hand washing, the distancing. All of those issues remain very, very important, because that's the only way we can defeat the next surge from coming up. We still don't know a lot of why Africa behaved in the way that it did, in terms of everyone thought Africa was going to have the worst impact of COVID-19. But actually, we fared much better. Some people thought, well, maybe we're not counting. Well, if you look at South Africa, we're not very different to the rest of the continent, but we can say for a fact that we've tested as much as could have been done. We have missed as much as any other country does, and therefore we can't be seen as where we didn't do enough. So we have too many people out there that can't be accounted for. In our case, yes, there will be, but it's in the same comparable pattern like any other part of the world. So from that point of view, we still have no choice. We have to go back to the containment measures. Containment measures, distancing, the use of masks and sanitizers, and also particularly as we're going to the festive season, because that is the season that's going to give us a flare-up, which was not necessarily inevitable. But it's a question of saying, as we walk in there, we must be aware that we can contain it and get past the festive season without a flare-up. It's all in our hands, and that's really the message that we want to send for today. Thank you very much.
Well, thank you very much, Minister, and we'd really like to thank all the colleagues for joining us. With Minister's permission, we may close this press briefing. Thank you, Minister. Thank you, colleagues.
Yes,